Question 161. Which goal of the client's care should take priority during the first days of hospitalization for an exacerbation of ulcerative colitis? A. Promoting self-care and independence. B. Managing diarrhea. C. Maintaining adequate nutrition. D. Promoting rest and comfort. Question 161. Answer: B. Managing diarrhea. Question 161. Explanation: Diarrhea is the primary symptom in an exacerbation of ulcerative colitis, and decreasing the frequency of stools is the first goal of treatment. The other goals are ongoing and will be best achieved by halting the exacerbation. The client may receive antidiarrheal medications, antispasmodic agents, bulk hydrophilic agents, or anti-inflammatory drugs. Question 162. A client's ulcerative colitis symptoms have been present for longer than 1 week. The nurse recognizes that the client should be assessed carefully for signs of which of the following complications? A. Heart failure. B. DVT. C. Hypoglycemia. D. Hypocalcemia. Question 162. Answer: C. Hypoglycemia. Question 162. Explanation: Excessive diarrhea causes significant depletion of the body's stores of sodium and potassium as well as fluid. The client should be closely monitored for hypoglycemia and hyponatremia. Ulcerative colitis does not place the client at risk for heart failure, DVT, or hypocalcemia. Question 163. A client who has ulcerative colitis has persistent diarrhea. He is thin and has lost 12 pounds since the exacerbation of his ulcerative colitis. The nurse should anticipate that the physician will order which of the following treatment approaches to help the client meet his nutritional needs. A. Initiate continuous enteral feedings. B. Encourage a high-protein, high-calorie diet. C. Implement total parenteral nutrition. D. Provide 6 small meals a day. Question 163. Answer: C. Implement total parenteral nutrition. Question 163. Explanation: Food will be withheld from the client with severe symptoms of ulcerative colitis to rest the bowel. To maintain the client's nutritional status, the client will be started on TPN. Enteral feedings or dividing the diet into 6 small meals does not allow the bowel to rest. A high-calorie, high-protein diet will worsen the client's symptoms. Question 164. Digoxin preparations and absorbents should not be given simultaneously. As a nurse, you are aware that if these agents are given simultaneously, which of the following will occur? A. Increased absorption of digoxin. B. Decreased absorption of digoxin. C. Increased absorption of the absorbent. D. Decreased absorption of the absorbent. Question 164. Answer: B. Decreased absorption of digoxin. Question 165. When used with hyperacidic disorders of the stomach, antacids are given to elevate the gastric pH to A. 2.0, B. 4.0, C. 6.0, D. 8.0. Question 165. Answer: A 2.0. Question 166. One of your patients is receiving digitalis orally and is also to receive an antacid at the same time. Your most appropriate action, based on the pharmacokinetics of antacids, is to A. Delay the digitalis for 1 to 2 hours until the antacid is absorbed. B. Give the antacid at least 2 to 4 hours before administering the digitalis. C. Administer both medications as ordered and document in nurse's notes. D. Contact the physician regarding the drug interaction and request a change in the time of dosing of the drugs. Question 166. Answer: D. Contact the physician regarding the drug interaction and request a change in the time of dosing of the drugs. Question 167. The nurse would teach patients that antacids are effective in treatment of hyperacidity because they A. Neutralize gastric acid. B. Decrease stomach motility. C. Decrease gastric pH. D. Decrease duodenal pH. Question 167. Answer: A neutralize gastric acid. Question 167 explanation. Antacids work by neutralizing gastric acid, which would cause an increase in pH. They do not affect gastric motility. Question 168. The nurse would monitor for which of the following adverse reactions to aluminum-containing antacids such as aluminum hydroxide, amphogel? A. Diarrhea. B. Constipation. C. GI upset. D. Fluid retention. Question 168 Answer, B. Constipation. Question 168 Explanation. Aluminum and calcium-containing antacids cause constipation, magnesium-containing antacids cause diarrhea and sodium-containing antacids cause sodium and fluid retention. Question 169. The nurse would question an order for which type of antacid in patients with chronic renal failure? A. Aluminum-containing antacids. B. Calcium-containing antacids. C. Magnesium-containing antacids. D. All of the above. Question 169 Answer, C. Magnesium-containing antacids. Question 169 Explanation. Magnesium-containing antacids can cause hypermansemia in patients with chronic renal failure. Aluminum-containing antacids may be used as a phosphate binder in patients with chronic renal failure. Calcium-containing antacids are also appropriate because these patients may be hypocalcemic. Question 170. The nurse would monitor a patient using sodium bicarbonate to treat gastric hyperacidity for signs and symptoms of A. Metabolic alkalosis. B. Metabolic acidosis. C. Hyperkalemia. D. Hypercalcemia. Question 170 Answer, A metabolic alkalosis. Question 170 Explanation. Solutions containing sodium bicarbonate, a base, can cause metabolic alkalosis. Serum K and serum calcium would decrease with alkalosis, not increase.